A recent publication in JAMA Psychiatry concludes that ketogenic diets improve depression symptoms. They evaluated 50 studies to reach their conclusion. These studies weren't all necessarily designed to treat depression, but they all measured some depression symptoms or markers of psychological well-being. It's not a surprise to us that the authors found ketosis beneficial for depression, and there were some helpful take-homes from the study that I'd like to discuss. So the first is that even in the randomized controlled trials, ketogenic diets improve depression symptoms. So across 10 different randomized controlled trials, the ketogenic diets produced a small to moderate reduction in depressive symptoms compared with controlled diets. Remember, not necessarily treating major depressive disorder. But the effects were significantly stronger when the study actually measured ketosis, with those studies showing a large improvement. So the paper found that the benefits were strongest in studies that verified nutritional ketosis with testing, or those that used very low carbohydrate intervention, so less than 10% carbohydrates compared to the more moderate carb reduction, or in participants without obesity with underlying metabolic health who were able to achieve ketosis more easily. So the bottom line is the more someone was in ketosis, the more they improved. But where does this leave us for treating depression with ketogenic therapy? So on the one hand, if someone is looking for a novel treatment for depressive symptoms, it appears we have ample evidence for them to discuss ketogenic therapy with their provider now. And likewise, providers should probably consider it a viable option to consider for their patients. The evidence is there and growing.